It is Thursday, April 23rd, and welcome to the COVID-19 Task Force Daily Update. I'm Joe Delormier. We have a busy program today. Lisa Westaway and Arnold Lazarre will be here. But first of all, we're going to talk to a gentleman who's out there on the front lines. He has been very busy. His life has changed. Certainly his job has changed. Let's welcome Corporal John Dee, Delormier of the Kahnawake Peacekeepers. First of all, welcome to the program, John Dee.
Thanks, Joe. It's a pleasure to be here.
Okay, so let's talk a bit about what's changed for you now that we're in the middle of a COVID-19 pandemic. Obviously, you and your fellow officers are having a different kind of experience out there. Tell us about that.
Well, yeah, and after March 12th, when the guidelines started going out and the directives started going out, our chief police, assistant chief of police, sergeants, myself as a corporal in our group, we started implementing the cleanliness measures, the general cleaning measures, hand washing and sanitizing measures immediately. And it proved to be quite a big task to get used to right off the bat, because we were used to coming in for our shift change, wearing the uniform that we're wearing during the day and then leaving in that same uniform and going straight home. That doesn't happen anymore. We're tacking on a good 45 minutes to an hour of our regular shift just to come into work in our civilian uniform, our civilian clothes, and change into a uniform that's already been pre-sanitized by the team that comes on after you. So it's a bit of a ballet to orchestrate all this stuff together and make sure that we're watching out for each other and making sure that we're staying safe and clean. And it does take quite a long time, and you have to make sure that you're ready to go for the start of your shift. Now, we also have to clean the cars at the beginning of and end of every single shift with sanitized wipes or sanitizing wipes. So every bit of cleaning, there's a lot of thinking that goes behind it. So when you're cleaning the car, you have to think of every place somebody would have touched: the steering wheel, maybe the radio dial, the seat, the control to move the seat. There's a lot of things that you have to think about when you do come into shift. So it is changed the way we even get to work and even start. And this is all before the next 12-hour shift.
Wow. So with the shifts, let's talk a little bit about the actual work that happens. What's changed in your duties?
Well, it's the way we interact. We all have to be looking at social distancing and respecting social distancing. And it is hard for people because you're changing your physiology, the way you move, the way you talk with people. I talk with my hands, and I usually would like to get close to people when I talk to them. That doesn't happen anymore. We respond to calls with masks that were provided by the department, with plenty of latex gloves. Everybody has hand sanitizer in the vehicles, so we are washing our hands after every single interaction. We're also cleaning down our vests after every single interaction. If there is a situation where we do have to go hands-on with somebody and make an arrest, which has happened since these directives have been put in place, and get to a little bit about that after, we're basically taking guys off the road so that they can get into their secondary uniform that we're all required to have here. Shower first, sanitize everything, and move on that way. So that's really changed how we're interacting with people. From community policing standpoints, just talking to people out on the street, we stay in our cars, remind people about physical distancing, but responding to calls has changed a bit. But don't get me wrong, it's not like we're not responding to calls. We're still the Kahnawake Peacekeepers, and we have to respond to crimes that are happening, or traffic violations that are happening, or emergency preparedness law violations that are happening on a daily basis with, for example, people coming to get cigarettes. So there's a lot of extra thinking that goes into not just preparing for work, now actually doing the work. But we are doing the work. And we're seeing a rise in impaired driving in the community. We are making arrests of that nature for that crime. It's not a free-for-all for ATVs. We want to make sure that people are still respecting the ATV law. It's still in place. And sadly, I mean, ATVs have been seized for people who are underage driving them, people who don't have licenses, they're not registered, they don't have insurance, all these things that you need to do to have your ATV going from point A to point B. So we're still enforcing the laws of the community, as well as the criminal code and the highway safety code. So it's not a free ride. We just need cooperation.
Obviously, there are some differences in how you're dealing with the public. How's the public dealing with you?
For the most part, we're looking at everybody as being respectful. Everybody's scared. If you say you're not scared, there's a part of you that's scared right now. And that goes for everybody. So because of that, we're only going to get through this together. So people have been very respectful of the Kahnawake Peacekeepers, and for the most part of all the laws. I'm talking about dribs and drabs that are happening with some of these offenses, but for the most part, people have been supportive of us, and it's not unappreciated. We really do appreciate that people are working with us, they're understanding the physical distancing and the hard job that we have to do as frontline workers. Granted, it's not as mentally difficult because police officers know what they're getting into when they get into this job. They understand that they're going to get PTSD one day, and it's going to be a slow burn. And I've only been on the road for 7.5 years, and I've seen some things that most people will never see in their lives that will affect me later on down the road. But what the situation has done is made people scared, but at the same time they realize they need our help, and we need their help as well too. And it's not as scary as, say, being a nurse right now, or a Kahnawake fire brigade worker. These are people that I look up to, as well as doctors and the people that are working in the hospitals, not just nurses, there's orderlies, there's a lot of people that make a hospital run. I look up to them, and I'm sure people are looking up to us to keep enforcing the laws in the community right now. So for the most part, Joe, to go back to the question, I know straight off of it, people have been extremely respectful and very, very helpful, and we appreciate it, and we want that to continue throughout this pandemic and afterwards, because we all have to live here together.
All right, well, John Dee, stay safe out there. I know you actually have to go back on duty and get in the car and make the round, so take care. Thank you so much for joining us this afternoon.
No problem, Joe.
All right, thank you very much. Corporal John Dee, Delormier of the Kahnawake Peacekeepers. Well, up next with some news from the Kahnawake Memorial Hospital Center is the Executive Director, Lisa Westaway.
Thank you. I wanted to talk about the testing site today. It's actually the only subject on the list from KMHC. So our testing site, we've tested a total of 187 people. I've said this before, I'm going to repeat it, that's a very low number. It's very difficult for us to be able to identify whether this low number is a result of the fact that our community members do not have symptoms and therefore do not need to be tested, or whether they simply are not coming in to be tested. And we are very concerned with ensuring the health of our community members. And so for that reason, and for also for the reason that we want to have more details about what's happening in the community. So we've mentioned before that we test in order to contain. We also, through the results of the testing, we get a better idea of what's happening in the community. And with that profile of what's happening in the community, we're better able to make decisions. So at this particular point in time, the results that we have do not tell us much about the community because it's such a small sample. So 187 people of close to 9,000 people is not enough to be able to tell us what's really happening in the community. Also, like I mentioned, the health of the community is really important. So the task force, we're here, one of the main reasons is to protect our community from COVID-19 or from the possible impacts of it, so meaning hospitalization and death. And therefore, in order to do that, it's easier for us to have a better picture of what's happening in the community. So because we want to better understand, because we want to have these numbers, and because we have really low low numbers at the testing site, we want to try to do things a little bit differently. So we want to change it up and bring the testing site to you. So how are we going to do that? The first thing we want to do is a health check of community members. So we're going to be calling you in your home, at your home, and asking you questions about your health, and really directly related to the symptoms that we've spoken about linked with COVID-19. And based on the information that we get, we're going to then offer testing sites in the different locations in the community. So we're still working out the details, but we're going to call it kind of an ambulatory testing site, and we're going to be in different locations of the community on different days. So as we work out all the details, we're going to have schedules, and we're going to be sure to communicate that properly with you all. But as a first step today, I wanted just to make you aware that you can be receiving a call from KMHC. So these are people that have been, these are all of our wonderful staff that have been receiving your phone calls up till now and booking appointments for the testing site. They're going to be calling people in there, calling you in your homes and asking you questions to do a health check with you, and speak with you about the possibility of testing at your home or close to your home. So again, we're working out the details, but I think it's important to expect that phone call, and we hope that you will answer the call and speak with us so that we can, even, you know, if you choose to not be tested, at least we have a better idea of what's happening in the community, and then we're better able to make decisions. That profile of health, we'll call it, in the community allows us to better prepare for the eventual reopening in the future. We're not there yet, but we are planning so that we know how to open, and having a good understanding of the health of our community allows us to make better decisions. So we felt that this might be an important step and change in our process that will allow us to work with you and ensure your safety as we move forward. So we thank you for your cooperation, and I'll be keeping you posted on the details. Thanks.
All right, thank you very much, Lisa. Very interesting proposal. Looking forward to that. Well, now we look forward to Arnold Lazarre's visit. He is a member of the COVID-19 task force and has been here on several occasions to help with our updates. So it's on to Arnold.
Good afternoon. Thank you, Joe. Just a quick review for today. They put out the communique saying the principles or the guidelines. Primarily, Kahnawake is for residents only at this point, and Kahnawake is still operating only on essential services. We're doing this, once again, in an effort to protect our vulnerable people. The numbers that we have are, the important numbers are very good. We know that by the end of the month, it is the intention of the task force to revisit or reevaluate all the directives. We know that the new normal, whatever it's going to be looking like, is not like the old normal. So we cannot predict 100% the future. We do know that as the weather gets warmer and as this event goes longer, people's patience, people's ability to deal are going to get frayed. And we keep on reiterating the fact that we need people to continue to be patient. That's what's going to get us through. We are dealing with it in a good way. The forces are all working together, and so what we want to do today is the task force is really a team effort. Lloyd and Joe mentioned the technical people that help us each day. We have our office staff that really do the heavy lifting. Today I'd like to acknowledge the work of our inspectors. They are mandated to go around and to ensure that people are following the guidelines. They're there primarily to educate and to make sure that people know the good practices. As with the Peacekeepers, there are times where they have to be a little more forceful and convincing people what is right. The people that are working today, or will not mention, are Mark Horn, Larry Jacobs, Brian Ibb, and Donald Gilbert from the Environmental Health Services. And from the Public Safety, Occupational Safety, we have Dennis Laborn, Lance Goodleaf, and Yoganoro Macumber. You will see them around and about. They're looking to make sure that people are practicing the social distancing as much as possible. They're there to help, and once again, everybody has a difficult job at this point. There is no easy position. So just to end today, we'd say, Kahnawake, you're doing very well. The numbers reflect it. We are going to continue for the next, until the end of the month anyway. We're looking at continuing the same path we're on, which appears to be working. And I trust that all Kahnawake Rona will continue to support each other. Now, oh, I have to, I would be remiss. I received a phone call from a community member, and she brought up a very good idea in the sense that when we acknowledge how well we're doing, it is very important to acknowledge that this wouldn't be possible without the help of Sunkwaya Disu. So in future acknowledgements, we think that of course it's very important, and I'd like to thank the community member for reminding us to acknowledge that we do have a lot of help from higher authorities, whatever your beliefs. Have a good evening.
All right, well done, Arnold. Just a little note before we leave. The next few days are going to be fairly nice. If you are taking part in the Kahnawake Cleanup Challenge, remember to contact Waste Management tomorrow at 632-4321 if you are going to register, because there's some nice prizes there. You can pick a little area where you and your close family members who live in one house, you can choose a little area to clean up, take a before and after picture, and you can win a prize. And it's just a nice initiative during this time. I'd like to thank Corporal John Dee Delormier for being here today, of course Lisa Westaway, and Arnold Lazarre as well. And thank you for watching. Be safe, be healthy, and we shall see you tomorrow with our next COVID-19 Task Force update. Nyao ko dano, onigiwahi.